Healthcare is the only industry where tomorrow morning I'm not aspiring to use your services.
What did you have to do differently as a marketeer?
Try to take away the scare in all your communications and all your form of communications. All your brand interactions need to start at a very early stage.
How important is content marketing?
We are doing 400, 500 videos a month. That we have started picking up small instances in your life. It's not just only content, it's about reviews as well.
Hello, everybody, and welcome to yet another CXO Show. As you're all of y'all are aware, we're doing the CMO edition of the CXO Show, where we are inviting some of India's most successful professionals in the field of marketing. The objective of the CXO Show, of course, is to have conversations with these leaders, actual practitioners of marketeers, and not really people that just put up posts on Twitter or X or LinkedIn and have no real understanding of the field. So we want to speak to the most successful marketing professionals that are actually practicing marketing. That's what we want to do. And of course, the objective of this show is to ensure that our listener gets something real, gets something implementable, gets something practical that he can pull out of this particular show and actually learn something that is going to help him. So that's what we're trying to do through this particular show, right? Today's guest is Dr. Ashish Bajaj, who is the group CMO at Narayana Health and a leading voice on industry trends, MarTech, and future of technology. Dr. Ashish is a globally recognized marketeer who has represented India at the Cannes Young Lions Media Competition. He is also the first Indian to win the Media Gold Medal from the World Health Organization at Young Spikes Asia. And most recently, he was named Marketeer of the Year by CMO Asia and the National Feather. Before making his mark in healthcare, he held key marketing roles at Microsoft, Ola, and Group M, giving him a rare blend of experience across tech, mobility, and media. With over 13 years of experience as a marketing leader, he is now redefining how healthcare brands connect with people. Welcome to the show, Ashish.
Thanks for having me on your show.
Yes, it's been a pleasure. I know this has been a long time coming, but I'm super excited about talking to you because of the space that you're in, and I quite frankly believe that that's an extremely important space for India as a country, and the more good work we do in healthcare, right, and all streams of healthcare, I think that's very, very important. So it's good work that you're doing, right? Ashish, you have such a diverse and very interesting background. Tell me, what is different in terms of being the head of a healthcare brand as against all your previous roles, right? Whether it was at Ola, whether it's at Microsoft, so on and so forth. What is distinctly different about being the head of marketing of a healthcare brand?
Wow, those were the questions that I was asking when I was joining the healthcare firm. But honestly, yes, I think healthcare is the only industry where tomorrow morning I'm not aspiring to use your services. I'm not tangibly looking at a positive outcome or I'm ambitious to use your products. Like tomorrow morning, I'm going to go buy an iPhone. That's something I'm ambitious about. I get up in the morning and I'm excited. But as a consumer, tomorrow morning, I'm going to go to a hospital. That's absolutely not the way the consumer thinks for the healthcare industry.
Wow.
So and more, it becomes so difficult as a brand to build whatever are so-called the marketing correct fundas, your loyalties, that you are first on the table, people are considering you. All of those jargon just goes out the window if you're talking about healthcare. So that's how different healthcare is from any other consumer facing servicing industries.
That's so interesting. I've never actually thought of it in that way, right? Because I know I can't think of too many other services or products that would have this particular problem, right? That you look forward to buying any other product or service, but you're not looking forward to a visit to a hospital especially a hospital, right? Even a doctor's visit where you may not look forward to it too much. It's not as dreadful often, right, as how a person feels when they have to visit a hospital. So tell me practically, give me a couple of examples, if you don't mind, Ashish, of therefore what did you have to do differently as a marketeer, right? Of something that would work otherwise in a certain setting but just doesn't work here. Tell me a couple of those things, because we want this to be a show about practitioners and somebody listening and picking out something useful for them. So what would be those two or three things?
See, the first and foremost is try to take away the scare in all your communications and all your form of communications. Because when I'm making a decision of utilizing your services or product, I'm already under so much of stress. And it's not the happy place to be. Thus, remove anything scary that you talk to me. Try becoming a person or a first or a second figure that is there when I require, not overtly stepping on to my toes, saying that, oh, if you're not gonna do this, you will have to get a cardiac surgery done. Or if you're not sitting properly, then your spines L1 and L2 need to be solved. So you don't have to make life difficult because your decision making is gonna be very difficult at a time when it would be required. Second, and I think it's again the topmost thing as a brand you should do is start thinking for them consumer first when they are consumers. Don't start thinking about them when they require operation theater or when they require meeting a doctor per se. So you have to start the conversation. You start the conversation from thinking about overall health and at a time when they're still the consumers. So your life or your brand interactions need to start at a very early stage. Then what the entire industry has been doing for decades and decades is, oh, hi, I'm raising my hand as a brand. I do the best possible outcomes for clinical or for surgeries. Please look at me. Rather than you making a stance and trying to keep the person healthy and start talking in a language that they should not be requiring that stage.
Wow, that's such interesting insight. Ashish, I'm gonna try to summarize, and the reason why I do a summary after an interesting answer is because I want the listener to take back something which is succinct for him. So I think the one practical thing that you said about what you need to do differently as a healthcare brand, and especially in the hospital space, right? I think healthcare is a very broad domain, is don't do anything that is going to scare the customer, right? So steer away from that, because as it is, he's so stressed out, right, about anything to do with hospitals. So I guess that's number one. I think number two, which is a very interesting thing that you said, is don't just appear in the life of a consumer or a customer when something goes wrong, right? Try to be in his life way before that, right? As somebody who's a partner in their health, so to speak, right? And so that they don't require your service, and then in the situation that they do, then of course you're top of mind for them in some way. So Ashish, for you to do especially the second part, right, about doing this, what are some of the initiatives that you've done that really work in your experience? I'd want to know a little about that.
So we started the this roadmap for us as a brand a couple of years back, and we started first showcasing what happens behind the scenes.
Okay.
And we started that by showcasing a very prominent thing, which is emergencies, trauma, and real life cases. We brought them forward in front of people in a manner that they are dramatized, but they showcase you what goes behind, what is the effort, basically humanizing the brand, humanizing the doctors also in a way so that they are also thinking about you. They are on the top in terms of taking care of you. And second, which is now quite prevalent with us, is as a brand that we have started picking up small instances in your life, the daily things that you do are going to give you not a positive result on your health in long term. The junk we eat, we formulated campaigns like think before you order. It's a cheeky take on us, we're just so used to food aggregators. It becomes so easy for us to order, and we usually tend to order things under craving. Those are not good for us. Think about things like what people do is clubbing chai and sutta together. So imagine these very, very small nuances that we do in our lives daily becomes a point of conversations with the consumers.
Got it. Very interesting. So one, of course, I think a roadmap that you have is around showing something behind the scenes, right, which in turn tends to humanize the brand and humanize the actual doctors, because I guess across the world, but especially in India, all of us expect our doctors to always create some miracles, right? And I genuinely feel that this effort of humanizing the brand, humanizing the doctors, I think is very important. And you said other interesting initiatives like I especially like the thing around junk food, right? And that insight that you have, because a lot of those things in turn, impact your health, right? So that's interesting. How, in your scheme of things, how important is content marketing in some way for you? Is that something in the modern marketing landscape? Is that something that is still very useful? Is it going up in usage, going down? Tell me a little about your experience around content marketing, especially as a healthcare brand.
So, Swapnil, content has always been the king. And when from ages, I remember my days at Nokia, when we used to be so heavily dependent on the content in terms of people understanding how to use internet on phones.
Yeah.
Very smart ways of bringing it out with just playing Antakshari on phone. I remember those days, and until now, see, the consumption has grown many folds. The accessibility of devices and data and platforms has allowed us to start consuming content than never before the way we were. Thus, the consumption going high, that means there is a change in habit. And for the change in habit, and if the marketing team is not able to catch up to the change of how the consumer is going to be introduced to your brand, I think then you are far behind in the line in terms of reaching out to consumer as a brand.
Got it.
And I'll just top it up on saying that because you specifically asked that in the realm of healthcare.
Yeah.
Why it becomes so important, because otherwise, if as a brand, I'm not going to take that stance as a healthcare brand, if I'm not going to educate you in the right manner, you are going to go search and you will end up having a cancer. So from stopping you from getting into a rabbit's hole, it's important that as a brand, I take the lead because I have the right clinical infrastructure. I have the right doctors. I have years and years of data to give you the right information. And if I'm able to do it right and provide you in a manner that you want to consume, I think you've done your job very well.
Got it. I find that very interesting that you say that. And I have two other questions, but the first direct one is, have you seen, Ashish, a shift in people consuming more video versus text? Any such shift that you think, or you think both are equally important from a content marketing point of view? Video is important, so is text. Tell me a little about that.
So it depends on the platform. I will say that let's divide it platform wise. When we are talking about, let's say, video consuming platforms, which is largely for us, YouTube is the leading one. We are doing 400, 500 videos a month. And this is about providing you the right information clinically about diseases, about trends. Because of so much of data that we have understood, we know seasonalities, well equipped in answering a lot of questions. So we are very open in terms of bringing them live.
Got it.
In front of our followers and consumers as well. So those ways, content in audio-visual format works very well.
Wow.
But let's say because of Facebook being the first app on the app, on your phones, a lot of text also works. So you will imagine that a static or let's say a text telling you about 4 things to do for the rainy season. That's good enough.
Wow.
And you won't believe something how much it is shared.
That's so interesting. Ashish, amazing. There's so many questions for you. So you said video works on certain platforms, of course, platforms like YouTube and stuff like that, but there's nothing taking away from text as well, because often there are certain simple things that you can do which are useful to people that then in turn, start getting shared. And especially stuff like listicles that you spoke about are very important. But you spoke about 400 to 500 videos a month. Did I get that right, Ashish?
Yeah, absolutely right.
Wow, but that means that's a lot of work that you are doing on content marketing. That's amazing. Typically when even we're talking to some of our clients, the question that we often get is, any video piece that is created, often the question is, "Arey, but how many views will it get, or how many likes will it get," so on and so forth. Clearly you have understood something where I think you've understood that both quantity of output that you put is very important, and of course the quality of output that you put is important, because very rarely do brands go up to 400 500 videos a month. Tell me a little bit about the thought process behind that. Tell me a little about your take on quantity and quality, and tell me a little about also the views dilemma that each and every CMO tends to have. So too many questions, but take them in the order that you'd like.
Absolutely, and you are having absolutely the right questions. Out of the three, the two I also struggle, because that's the answers I am also giving to my leadership as well. And all the three are the ones which my team is trying to give answers to me as well. So
Yeah.
you are spot on in terms of getting the real practical voice out from that point of view. See, one is, the first thing to understand is the platform equipped enough to ingest these many videos. And I think there is a -1 to this is, do you have the capability? And let's say in the marketing world, do you have the supply of creating these number of videos? Thankfully, yes, because we are present across India, we have many hospitals, and we are blessed with the right clinical talent as well, who's educated and knowledgeable enough to share those kinds of take, and is ready to record them as well.
Got it.
So I'm talking about a 1:1 1-minuters, which we heavily depend on in terms of creating the content, just like how you and me are talking, is what our doctors are also. And that's the kind of quality we try to maintain in terms of saying whatever guidelines that we have in terms of doing it, because we are thinking ourselves as a content production factory. Okay. Now come to views. And yes, we've been even with YouTube, we have seen that while we are uploading so much of content, that usually doesn't mean the entire the channel is also getting that kind of views or landings to, or increasing our subscribers. That also doesn't happen. It's not linear, and not always all your videos will have those kind of views. So as a custodian, or as a team, marketing team or a social media team, you need to understand which are my PCOs, which are very close to what people are looking out for, or is the right information that you need to put out.
Got it.
So you can't have all your 400 odds to be driving lakhs of views. You will have to prioritize that, okay, for this month, these 1% of these videos is what I'm going to push for, where I'm going to put all my might behind. And I will drive it not only just one channel, but these will be visible across. Not only just then the consumption happens on YouTube, and you need to increase your consumptions to Insta, to WhatsApp, to your internal channels, through your employee base, so that those are the ones who are getting you the largest share of monthly views for you.
Got it. Got it. That's very interesting. So, it seems like everybody in the field of marketing always has this dilemma or fighting these same battles because it's such complicated issues, right? I always, this is my opinion, and correct me if I'm wrong somewhere, Ashish. What I tend to tell brands is that, everything depends on the category that you're in. And what are you using these videos for in some way, right? These videos or any content that you put out tomorrow, you could have an on the edge patient or a consumer that will say, hey, should I go with this brand or should I go with that brand? And they're going to, in the process of their research, they're going to probably, go visit your website. In the process of their research, they're going to go visit your YouTube. In the process of their research, they're going to check their Instagram, as all of us do today, Ashish, right? Today, when you want to buy something, you go to somebody's website, you check their Instagram out, and when you see that a company has taken so much of an effort to put out so much of content, I think that builds a lot of faith in the mind of a prospective consumer in some way, right? Saying that, you know what, this is the brand that I should go to because they seem like they are experts at the topic of healthcare or experts at the topic of, luggage. I have luggage in front of me, right? So they're experts on the topic of luggage or they're experts in the topic of eye care, so on and so forth, right? So a lot of this content, often we feel like, oh, this needs to get hundreds and thousands of views. And I keep telling my whoever would listen to me, to say that it's not about the views in the end. It's about that one person that will come on your website or come on your channel and feel like, wow, these people are experts at this subject. I must consume their product in some way, right? And that's where I think content marketing really, really, really helps. In some way. So, am I right in the way I'm thinking? Is there another way in which you would frame this?
So, I think just to add to that
Yeah.
is it's not just only content, it's about reviews as well. In our healthcare industry,
Yeah.
so imagine that is, I want to read what people are saying about this particular hospital, this particular doctor, this
Yeah.
particular surgery.
Yeah.
How are they rating them? So why we identify these things 3 to 4 years back and we started building on to them. One is, of course, you're one of the biggest channels on social media. That was by design. That you wanted to push for being the biggest channel so that somebody who's looking for a right solution takes it by saying there are a lot many people who are behind this brand. Might or might not have that if Ashish has put up a video about a specific, let's say, seasonality or a disease, might not have lakhs of views on it, might be just, let's say, 400 of them. That also gives me the confidence that there are already 8 lakh people who are looking or hearing from this as a brand. The second most important part become, and these are because of the insights that we hear it from our clinicians as well, that people want to, while they're searching, they want to know how many reviews do I have as a,
Got it.
what's my rating. So Ramil will be very surprised to know also all our Google My Business profiles. We are one of the best rated hospital ecosystem, healthcare ecosystem, and the highest number of reviews as well.
Wow.
All put together.
Yeah.
If we look at Narayana Health and all the 1800 listings that we have,
Yeah.
if we put together, we are 4.8 rated. The number of reviews, the sheer volume of reviews is huge. So it gives at least somebody who's making his journey from consumer to being patient a little bit of confidence while they are searching about that. Do they know what they're doing?
Yeah. That's so lovely, Ashish. So I think what somebody can take back from this thing is to say, content marketing is important. Your social media is important for sure for you to come across as an expert, even if it's not, about the millions of views. On the other side, give the reviews that you get equal or possibly, more importance than that, right? Because you're right. Today when a, customer, any kind of consumer across industry is taking a decision, I think Google reviews is one of the things that all of them are referring to, and both in terms of quantity of reviews and what that overall rating is, right? And I think that is put every business on their toes in some way, right? Which is very good, which is a net positive for everyone. And of course, you have a few people that really go and abuse stuff like this, right? But I think overall, it's most businesses are better because of stuff like Google reviews that really, up their service in some way. Wouldn't you say?
Absolutely,
Yeah,
absolutely. The
yeah.
way we order on our food aggregators, we look for which is the top rated and highest reviews. So, e-commerce is to be blamed for it. That it's a habit change that happened, and now it's become a norm in every industry, like how you pointed out. And if you're falling behind, then your overall digital strategy is falling behind as a brand.
Correct, got it. Ashish, so then of the say 400, 500 videos that you put up, your strategy often is to say let all of them go organically across all my social media platforms. Then if you see one video or piece of content performing really well, do you then boost it further? Is that the way you go about it, or you just think that the best way to go about it is just let it be organic, no need to boost any piece of content? Tell me a little about that.
So we do boost, like how you said, the
Yeah.
ones which either we feel are the utmost important for that particular month, or otherwise which are organically picked up for us, or in the quarters also.
Got it.
So understand something? Healthcare, and when you have brick and mortar stores like clinics and hospitals, in our case, these businesses are very hyperloop. A doctor in Bangalore will make sense for somebody who's living in that area and not pan India.
Got it.
Those legendary figures have already been established in the field of medical, like how Dr. Chetty is, and many more, where there is a pan India view of a particular doctor is established, and their point of view is sacrosanct across because they are legends in their own ways. But otherwise, the consumption happens very hyperlocal. So while you're picking up the strategy, the media strategy behind boosting or putting in your monies on which ones, you have to also be cognizant of the fact that I am doing what I am doing for that particular area as well.
That's very interesting. So you have the dual challenge of marketing hyper locally, because in the end that's where your consumer is for that particular clinic or hospital. But on the other hand, you also need to have a slightly more national brand building, so to speak, right? Given the fact that you are a national change expanding into different areas, you have that dual task. Would that be the right way to frame it?
Absolutely.
Right?
Absolutely.
Yeah, that makes it extremely challenging. Ashish, tell me, how has AI helped you as a marketeer, right? And I want a very specific answer for this thing, right? Because I ask this on each and every episode of ours because, of course, there's no podcast without the discussion of AI, right? And, very often what tends to happen is there is a lot of hype around stuff, and but when you speak to actual practitioners, right, that hype doesn't translate into how things are happening on the ground, right? So tell me, how has AI really helped you in a big way as a marketer, you and your team? And tell me areas in which it's still not really helping, although there's a lot of hype around that, right? So tell me a little about that.
So, Swapnil, I'll start it from a little bit even at a 30,000 feet.
Yeah.
Like how you mentioned, saying that there is no conversation or a podcast for you completed without having the conversation of AI. And for me also, when we talk AI, for me, the conversation is not complete. Are you training your team enough?
Got it.
The first thing to ask from anyone who is going to be a AI stalwart, or let's say the front runner, I think before acquiring any tools, have you trained your team or not?
Got it.
Because that's the basic fundamental between the 0 and 1.
Got
People
it.
who are actually using it, and people who are just saying that it has a lot of potential.
Got
So
it.
from conversations to execution, I think that's the point one. Now, if you're already in the process, there are certain things, certainly, which is life has been made easy. And imagine for healthcare, a situation like, let's say, God forbid, never happens, but let's say a situation like COVID arises again, and which is unknown. How quickly can I go to market with the right information and create those content pieces for people to know? I remember during the COVID, I was with a digital healthcare brand then, and it took us 9 days to get the first audio visual content, though it was a 3-part series from a doctor in house about what is COVID and what is not COVID, because till that time it was all static that was coming out from our healthcare brands.
Got it.
Otherwise, it was government who was doing those press conferences where you could understand. It took us a lot of time to come out with those kind of content pieces. And now, without shooting, we are creating content which is within 48 hours. Second, because like I said, that we are hyperlocal, we are working in terms of understanding the nuances much more better and creating a static out of it in terms of how hyperlocally people visualize yourself or people visualize their own city, their own district, their own area. So those insights have become faster for us. Of course, you have, because you've been working in the field and you've been for 25 years, so you have those understandings with you. But that insight, working with the time, giving you a content piece where you can experiment at much faster rate.
Got it. Okay, I'm going to summarize what you said. So I think you said, as a leader in the field of marketing, the first question around AI needs to be, are you taking enough of the effort to train your people, right? Because when you focus on training of your people, that's when the conversation will actually go into execution. So that's a good tip for every leader, to actually train your people in AI. I think the other big point that you've made is the speed at which you can put stuff out with the AI. It's much faster than what you would be able to do earlier. And I think the third point that you made is around AI is helping us hyper localize stuff where required, right? So currently it may not go to the extent of hyper personalization, but at least hyper localization in your context, because you have so many different clinics and hospitals which operate all over the country. That is where AI is really helping. So in terms of the actual tools that you're using, Ashish, AI tools, what are some of the tools that you or your team are really using and finding benefit from?
Right. See, the current tools that we are using, of course, from a paid point of view, while you are spending on performance, how are you segmenting your campaigns? How are you segmenting your creatives and building on? So you're using your current AdWords accounts, building the layer of AI on top of it, with Gemini adding the value to it. We are using, in terms of, while we are co-creating our content, we are internally working on it, is our Medha platform, which is our analytics platform, which has a AI layer built on top of it in terms of understanding our first party data much better.
Got it.
So that's an internal tool for us. Plus, of course, your agentic AI with Salesforce, we are working with them as well in terms of understanding and how that can be deployed across our CRMs. And fourth, we are currently working in a phase in terms of driving assisted mode for our call center agents, where they will be able to understand and apprehend or give better solutions to people asking medical queries.
Got it. That's so interesting. So you're not just talking about the marketing, but just at so many different layers you're being able to use. I have a specific question, especially on the AdWords part. With the Gemini AI layer on AdWords, and I don't know whether you have this data ready with you, but have you seen any difference in the kind of ROI that you used to get before the Gemini layer versus after the Gemini layer?
I don't know how nicely I can put this, but I remember the time when AdWords account started and search started with a CPC of 2.5 rupees back in 2012, 2013. I was getting 25% conversions, so my CACs were not even 100 rupee. Because it was a time when I wanted people to taste the new technology. And I might be I might be coming out very, very rude in terms of saying that, or let's say, I don't know what word I should put for it, but for me to taste the technology which is new, fall for it, currently it's giving you the results.
Correct. So what you're trying to say is earlier it was much more low cost and giving you results still back in the day, although it was much more low cost. Currently, the costs have gone higher, but you still feel that there is a good ROI on that, is what you're saying?
Yes, and
Yeah.
also I would say that there are enough and many more let's say startups and third party tools that have come up, which can help you build on to your advert layer
Got it.
as well. So
Got it.
whatever capability Google has built up for themselves,
Got it.
you have other third party tools as well who sit on top of it and spend your money basis that.
Got it. And you're seeing that whether it's the Gemini layer or this third party layer, that is helping in making your campaigns more effective in some way, right? Are you experiencing that?
Because you are able to try so many things in simultaneously, or let's say parallelly. You're able to try so many experiments, and you're able to track which were humanly not possible earlier, and make changes real time so fast that they are able to give you that kind of ROI as well.
Got it. So
You
I
won't
think,
believe,
yeah.
sorry, I just want to add,
Yes.
you believe that now these third party tools that I'm talking about, and I don't want to name them, but they're very, very known in the market as well. They're providing you confidence by saying that whatever delta revenue that you get, or the delta profit that you make on it, I'll only take 20% as my commission. The rest is whatever is your spend. So that's the confidence they have on their products.
Got it. So this is very, very interesting to hear. And correct me where I'm going wrong in my summary of this. You said, you're a long time practitioner, so therefore you've used even AdWords in its very early stage, right? And you saw the ROI. Then today, you're using a lot of course, the Gemini layer and the third party layer, which again is still giving ROI. And there are so many, and the reason why it's giving ROI is your ability to experiment very, very quickly and know what's working, know what's not working, and that really helps. And to add to that, like you said, the confidence that the third party players are bringing is also not just making claims, but saying that we're confident enough that we will, take a pie out of the additional profits in some way, or the revenue, right?
Absolutely.
Yeah. So basically, the AI layer is really working for you there. Tell me, Ashish, as a CMO, what is the tool you're using the most? So a lot of these tools probably your team indulges in. What is the one AI tool that you're on most?
Just like how I'm daily spending at least couple of hours on WhatsApp, Copilot is my next best.
Oh, okay.
Because of course you're using all Microsoft products, so it's a natural extension for you. But and I've been using that for now at least over a year now, and it assists me in terms of making my PPTs, making my notes ready, and has over the years for me learned and kind of adapted in terms of how I think and what are the kind of answers that I'm looking at. So Copilot is my go-to guy.
Yeah, Copilot is your go-to guy. That's very interesting. Tell me, because you've given us such specific insight, Ashish. I've really enjoyed this interview. That's why. What about performance marketing? And here, in the context of performance marketing, I'm talking about more the meta products, especially around Facebook and Instagram, right? Because again, the costs here used to be very low, but every marketer that I'm speaking to now is saying that the costs have kept going up, and therefore the return on investment on that is not what it used to be. So whatever you can share, what's been your experience? Does it still work as platforms, or do you think that requires some reinvention? Tell me a little about that.
Again, your point, Swapnil, is very true. If you somebody is evaluating meta platforms as a performance tool and are sizable business, by sizable I mean that was a capacity of spending at least let's say 5 to 10,000 USD a month.
Mm.
They are seeing a dip in their ROS is going down. They are seeing their CPC is going up because CPC as a platform level is going up, and it's been going up since last 5 years, and
Got
it's
it.
going up at a 30%, 18% year on year in different years.
Yeah.
But I think at an overall level, when you look at, let's say, the entire digital marketing spectrum and these silos we marketers have created. And by silos, I mean the channel silos, which is what's happening on your SEM, what's happening on your GDNs, what's happening on your meta of the worlds. But the consumer is flowing liquid. Now, when I look at telling you that Meta is the best platform for you to build visibility and a quick reach for your product or for any form of communication that you have developed, your conversion might happen through Google products
Got it.
because that is pull.
Got it.
Okay, but your first interaction or at least a little bit of engagement in terms of knowing more will be happening on Meta.
So
And
interesting.
why I'm saying that, Swapnil, because that is how consumers habit is become. It's a text based pull that I look at doing on search platforms. Now, of course, with the AI prompts, I'm not even going to the websites. I'm just doing the top prompts. But at when I'm at Meta platforms, I'm engaging with the content because content is not just text. Is somewhere text. Is somewhere AV. It's somewhere too much more. So that's allowing me to engage and know more about your product. At the end of the day, the conversion might be happening at SCM for me. So that is very important for somebody to understand. Before making the tall claim or saying that the ROS is going down, yes, it is. There's no damn, there's nothing wrong in saying that it is, and that's fact as well.
Such an interesting take, Ashish. Very, very interesting. So you're saying that it's, we marketeers have created channel silos, but that's not how our consumers operate at all. The consumers are like, liquid. They're flowing, right, from here to there. You said that while the ROS and has gone up for sure over the years, I think you're saying meta platforms are still the best for quick reach and visibility, and that's where people engage with the content. And like you said, the final conversion could happen on a Google platform or on a search platform or correct, right? That's where the final conversion could happen, but that's not the kind of right way to look at stuff. Ashish, one of the reasons why I've really enjoyed this conversation, and I think you're an extremely good marketer, is because there's a very nice quote that says, "Not all that you can count must be counted in some way," right? So, very very often, if a marketer just goes and looks at the quantitative metrics of everything, right? I think he's going to fail as a marketer because there is so much beyond just that quantitative metrics that you can see. And just because that's easy to see, so many calls are taken based on that, right? I'm sure often in any company that you worked for in the past, there would be a lot of internal pressure and internal, justifying that's required to the non-marketing folk and the leadership and I'm not talking about your current company, but just, generally, the CFO would question saying, "Arey yaar, par isse to kuch nahi aa raha hai," and we're spending so much money on that, right? And very often defending of that becomes very, very difficult because there's so much in marketing which is, the softer aspects of it, right? That are as important as that. And I think you do a very, very good job of articulating the importance of the quantitative, right? And really tracking that and really doing that, but also not forgetting that that's not all that there is to marketing, right? You could have certain platforms that are just visibility platforms, reach platforms. You may see the ROI, the ROI diminishing there, but that's not the way the consumer functions. And I think that's such a amazing insight for the fellow CMOs that could be watching this particular show, and I think young marketeers too, and as a matter of fact, even people outside of the marketing world, right? I think any business person watching this, that I think is very important. That just because something can be measured doesn't mean it's important, and just because something can't be measured, right,
It's not.
doesn't mean that it's not important, right? So I think that's a very very interesting take that you've given us. What are some of your favorite brands, yeah, Ashish? What are Indian brands that you really admire, and why do you admire them? Tell us a little about that.
Uh, a lot of them.
Hmm.
I love for what hyperlocally Tata Tea has done
Hmm.
in the last 4 years.
Hmm.
They changed their strategy from being that national brand to
Hmm.
taking tea to each and every city
Hmm.
and area has its own flavor of how tea is consumed and
Hmm.
how they brought in the local flavors
Hmm.
of people
Hmm.
with the brand. The
Hmm.
work they have done.
Got it.
So Tata Tea is one of my favorite.
Hmm.
While I was at Ola, we used to love us in terms of being the most socially active and starting certain things socially first.
Hmm.
While there were not many brands doing at that point in time, I'm talking about back in 2016, 2017.
Hmm.
Um, so kudos to the team in terms of Ola being, but then Zomato became the favorite.
Hmm.
Why? Because they were super ready in terms of holding on to the pulse,
Hmm.
and they built up, their entire brand profile
Hmm.
very apt for the consumer that they are targeting.
Hmm. Yeah.
Yeah. Apart from that, all-time favorite is Fevicol
Hmm. Yeah.
because it's such a complex consumer problem in way of targeting, because your buyer is absolutely different. Who's somebody who's a guy who's going to buy into a B2B,
Hmm.
but you are doing the entire B2C story with the brand.
Hmm.
That's amazing,
Yeah.
amazing. Because I think, Swapnil, the question that you just asked me,
Hmm.
uh, I think the CFO got into the conversation saying that it's okay, let's do it.
Hmm.
I might or might not see the impact now, but over the years,
Yeah.
it is what it is.
Yeah, absolutely. I think all the brands that you spoke of, right, have had such a big cultural impact, right, and are in our lives in some way. And all of it, Ashish, has got to do with creativity and innovation that they use. In a lot of cases, very what may come across as risky strategies, what may come across as a waste of money conventionally, right? But that's what they do, and that's what they succeed in so often. Because if you think of Zomato, I think of the current brand, Zomato is my favorite as well, because Ashish, Zomato is not really catering to a young audience. They're catering to everybody that orders food, right, in some way, which is everyone. But they've made themselves so relevant by doing very inexpensive yet creative stuff, right? And it's really a brand worth admiring, and I think they've done a fantastic job. Of course, Fevicol is every marketeer's all-time favorite, right? Because the whole thing, I think, two brands that come to mind that had a similar dilemma. One is Fevicol, the other one is Intel, right? Intel really did such an amazing job of Intel Inside that all of us still remember through those years, because it was basically a B2B product. It was something that was just going into your computer, but it became so relevant that even as a B2C consumer, you'd ask the guy saying, "Isme Intel hai na? Is there Intel in this or not?" Right? And so the same thing for Fevicol. Fevicol did such a fantastic job of being a cultural phenomena, right, so to speak. And very interestingly, I haven't seen them do a lot of stuff of late. So I wonder what's
Yeah.
happening, right? Because everybody would look forward to their campaigns, right, in a big way. Ashish, what do you do to really stay in touch with your consumer? Do you have a certain strategy that you practice that helps? And the reason why I'm asking this is that a lot of times the higher up you go in the hierarchy, right, and you're the CMO right now of a very large organization, sometimes we get so busy in meetings, right, that we end up losing touch with the final consumer, and then your campaigns are a little bit of a, or all the marketing work that you do is a little bit of a reflection of that thing of the CMO not being in touch with the consumer. So is there something specific that you do connected to that? Tell us a little about that.
So I'm very thankful to my managers when I started working at the
Correct.
media agency. They used
Correct.
to push me in terms of keep speaking to consumer, because that was a habit that was formed at that point in time. Go to the FGTs, sit for the calls, and it's okay even if it is boring. Just keep taking your notes, and quarterly we used to do this, and we used to have sit outs with the managers in terms of having a conversation of what you've learned new this time.
Got it.
So it was a habit that was given to, matlab, kind of baked into you in term while you were growing in your corporate world. Even till now, I keep stepping into the our hospitals and in our OPD areas where I just quietly observe what's happening, what are patients and their caregivers are talking about. Keep going through your reviews that you're getting. Keep going through keeping a tab on your ORM channels, ORM tools in terms of understanding the positives and the negatives. And more or less, when you go out in the market, meeting different, let's say, corporates, insurers, because those are the relevant stakeholders for us as a healthcare brand, we tend to listen to them more because what they are hearing for us. So if you are able to build up these kind of habits, I think anyone, let them be going up higher level or be the topmost guy in an organization or in a vertical. I think this only takes up like what, 3 to 4 hours from your entire month.
Got it. Got it. So your what you're saying is that it's important to keep those conversations alive with your consumers. You need to listen to them whatever platforms that you get, you need to listen to them, right? So that listening could be in terms of going through the reviews in a very detailed way to see the language, to see what's happening. It could be the on the floor conversations that you have with your consumers who are your patients to see what's happening there, or it could be the other stakeholders that you're talking about. But doing that is very, very important and needs to be kind of baked into everybody's system, because very often I find there to be a big disconnect between what people want on the ground and the beautiful campaigns that we marketers love to put out, right? Because I think creativity is very important, like we discussed, right? The iconic brands get created because of a lot of that creativity and innovation, but the creativity needs to be based on some insight more often than not,
Yes.
right? And if that creativity is not based on some deep insight, I think that's when the campaigns miss the mark in some way, right? And we've seen, Ashish, way too many campaigns that are very, very funny, but often, they're not based on insight and they don't really connect with the brand as strongly as you'd imagine. Ashish, what about TV advertising? I'm assuming that in your current outfit, y'all don't do TV, or if y'all do, please let me know. But has stuff like TV advertising, newspaper advertising, magazine advertising, has that lost its luster in some way? Are we in a total digital environment? Tell me a little bit of your take on these slightly now is what is considered old school media channels like magazine, newspapers, linear TV, right? What's your take there?
See, I think you need to decide about who's your target audience. If you're targeting 40 plus, there's no better medium than TV yet in India. It will take its own sweet time in terms of building a brand out of just digital advertising, let's say mainline digital advertising through, let's say, TV equivalents, OTTs.
Got it.
Because the clutter is too much.
Got it.
We still need to find out that one brand which I can give you as an example. Okay, this is the one which built up. Whereas over the years, or let's say even in last 5 years, you can still name a lot of new brands that they've come into the field or are on top of your mind because they've utilized that particular medium very well. So I still feel it is not lost its lust, given the fact we are 400 million plus households and still largely a single TV household nation with almost 500, 600 all DTH still installed and people are consuming the content just by the sheer one little less clutter than the digital interface. Second, the size of the screen that gives you the awe in terms of message being taken well. These are, and like we discussed earlier as well, as a consumer, you flow through. And I don't see as a silos in terms of while I'm watching something on TV because you won't believe that we are at my house also it's a single TV household. When we consume TV, we consume it together as an entire family. And when we do that, of course, you're using your phones on the side of it, but still the entire attention is there. Now, when you talk about us as or let's say any brand, yes, if you have those budgets and if it makes sense for your audience, these are the mediums to be, but they act in their own manner. Now, if I have to build quick reach, I'll use newspaper. If I have to build not only just quick reach, but I have a new information as well, then I'll do newspapers. If I have a communication that needs to be explained well, given that I have the money, use the TV advertising. When your demographics that you're targeting or your teaching that you're targeting is there, depending on your own genres, we have a very different take. We utilize TV as a platform, again, providing the right information. So here our doctors are talking about, let's say, seasonality, let's say diseases, young guys getting cardiac arrest. So we're taking our doctors onto platforms which have enough reach for the target audience that we want to reach out to and give them the right information, and they feel that is credible. So our utilization of these mediums are very different. Not just running a 30-second.
Got it. That's so interesting. So your take is, and which is a very, very nuanced and nice take. Your take is to say, no platform is good or bad. It depends on what your objective is as a marketer. It depends on, who's the consumer that you're targeting. That's number one. Everything starts from that. Then you said that, TV, especially TV, works extremely well because, a number of households that they're in, but because of the awe that it creates, and that's absolutely true, right? I think my biggest consumption of TV is around sports, right? For me, it's all kinds of cricket, we're hooked on to, we watch all the time, and we tend to watch it on a big screen more often than not in the family. So you see a lot of the ads there, and I was doing an interview with a few founders, and the only reason why those brands were stuck in my mind is because of the interesting TV campaigns that they did during an IPL or during some cricket match, because it came on the big screen and it had that kind of a impact on it, right? So yeah, I think that's a very, very fine take. And I think also newspapers, Ashish, I think what has happened is there is a big shift in the newspaper somehow and the magazine audience, right? Because the newspaper has stopped coming to my house a long time back, but that doesn't necessarily mean that it stopped going to other households, right? But the only thing that I also see, Ashish, is when I look at publications like the TOI in Bombay, I can see that they're becoming thinner and thinner and thinner and thinner and thinner, and the number of ads that are coming on them have depleted over the years. Because I remember a Bombay Times, for example, sometimes used to be such a fat Bombay Times in itself, right? Now Bombay Times is basically 2 or 3 pages, right, so to speak. So there is a definite change that has happened as far as newspapers, at least in urban areas, right? Now I don't have enough insight into how the urban areas are consuming newspapers, but here for sure there is something happening there.
Yeah.
Ashish, we've run out of time, unfortunately. I could talk to you for a very, very long time because I think you're a marketeer par excellence. You have an extremely insightful take on most things. It's a very mature take. It's not a take which is, you're not just going with the flow where if everybody says something, you're not just saying that, right? It's a very, very, very thoughtful take. I've really enjoyed my conversation with you, and I'm sure our audience is going to take a lot back from this, as I have myself from this conversation. So thank you very much, and I hope you and your company loads of luck because you all are involved in an extremely important sector, a sector that really matters to India, right? Because in my opinion, nothing which is quite as important as good healthcare, which is something that your company is doing. So thank you very much.